Hi, I'm Rod Goodyear, and I'm here today with Lisa Ferdinand, who's going to talk to us about how supervisors can recognize and address relationship difficulties with their supervisees, but also to help their supervisees do the same with their clients. This is such an important skill. And just to introduce Lisa a little bit, she's the Assistant Director for Clinical Services at the University of South Florida, and also currently chairs the section on supervision and training for APA's Division 17 in Counseling Psychology. So, Lisa, let me get started by just saying that the title of your talk has to do with ruptures and strange, was kind of an arcane language that I know our field uses. So, would you talk about what you mean by that?
I think in the most basic level, a rupture is just a breakdown in the relationship, either between the client and the therapist, or in supervision between the supervisee and the supervisor.
Mm-hmm. It seems to me that in any significant human relationships, whether we're talking about friendships or marital relationships or professional relationships, there's always going to be challenges and strains and ruptures and so on. What is there about the supervisory relationship that's unique in that way?
Yeah, that's a really good question, Rod. And I think I'll take each one separately.
Okay.
In the client relationship, I think why it's so important is that ruptures have been linked to client outcomes.
Uh-huh.
So we know that when the therapeutic alliance is stronger, then clients tend to do better. And when there's a rupture, they tend to do not as well, and in some situations, they will even prematurely terminate from counseling. When we think of the supervisory relationship, it's also important because when there's a rupture in the supervisory relationship, supervisees may start to be less honest or direct in supervision about what's going on with their clients. And since one of our main jobs is to make sure that we're protecting the client, we can only do that if we know what's going on in therapy. There's a real significant risk in terms of our gatekeeper function and our protection of the client function if our supervisees stop being as honest and direct with us.
Lisa, I know that you prepared a case example to help us get our heads into the topic for the day. So maybe you could walk us through it. And I know you've ended then with some questions that the members of each group can talk about among themselves.
Imagine that our supervisory dyad, the supervisory is a 28-year-old cisgender heterosexual Latina female of Mexican descent. She meets with her supervisor, who is a 30-year-old white cisgender heterosexual female who has resided in Southern California for her whole life. They meet for weekly supervision as the supervisee accrues hours for licensure as a mental health clinician. The supervisor has just met California requirements to become a supervisor and is new to the clinic. During their second supervision session, the supervisee begins sharing experience with a new client. The 18-year-old Latina client was reportedly adopted from the foster care system by non-Hispanic white parents and currently identifies as white like her family. The client is depressed and reports she's pretty much always been sad and anxious in social situations. The supervisee expresses some confusion and frustration that the client identifies as white and denies her ethnic identity. The supervisee additionally states it's obvious that many of the client's concerns are related to the difference between how she sees herself and how she is seen by others. The supervisee shares that she tried to begin sharing her conceptualization with the client towards the end of the intake, but the client seemed uninterested. The client also seemed hesitant about scheduling a follow-up session, but eventually agreed to do so. The supervisor briefly validates the supervisee's frustrations. She then reminds her that ethnicity may not be a salient identity to all clients. She adds that they are a very busy clinic, and due to their high volume, they need to focus on meeting their clients' needs as quickly as possible. She redirects the focus of supervision to exploring the client's stated presenting concerns if she decides to come to the next session. The supervisor looks confused and sad. She quietly agrees with the supervisor, and the conversation shifts to managing the client's symptoms of risk, depression, and anxiety. Do you think relationship strains occurred in this example? And if so, between which persons and at which points? In clinical relationships, while not ideal, I think when clients are upset or there's a big rupture or a strain, clients can choose to just leave the relationship, and depending on the setting, they may just request a transfer to a different clinician, or they may seek another clinician in the community. And that's not ideal. And so a lot of the time in those relationships, one of the things we want to teach our supervisees to do is how do we facilitate good communication so that if there is a rupture, clients feel like they can bring it up, because we hold more power in those relationships as therapists. There are also tools we can use. So if you use a therapeutic bond tool before or after each session, that might give you a hint that there's rupture and let you know that something needs to be discussed. And all those things can be helpful.
Okay.
In the supervisory relationship, again, there's a power differential, but I think it's really important to consider that supervisees usually can't just leave the relationship, at least not without significant consequences. And so again, in this relationship, we can use a supervisory bond score or tool to help us know when there's something going on, or we can bring it up at the beginning of supervision as part of the contract, or as part of informed consent in supervision, to kind of introduce if something was going wrong, if you felt like there was a miscommunication, if you felt like I offended you in some way, or if our expectations aren't on the same page, what would we need to do for you to bring that up for me?
Thank you for reminding us of that. I know we've talked about the contract at various points in this training program, and I think that this is just an excellent addition to that conversation. That's really the time to have that conversation about permissions to talk about relationship difficulties and so on. Lisa, what are some of the causes of relationship ruptures in both supervision and therapy? I know we're kind of mixing both, but both are important to supervisors.
Sure, but they can probably be grouped into 4 main categories for both supervisory and therapeutic ruptures.
Okay.
The first one I kind of think about are mismatched expectations or communications and misunderstandings. So that might be, again, just maybe we weren't clear enough in the supervisory contract about what the expectations were in supervision or in therapy. And in therapy, I think about, because I work in a very busy clinic, the model of therapy here is very different than it might be if you were in a private practice setting. We have to be really clear on expectations, otherwise our clients get sort of disappointed that we're so short term or moving so quickly. And again, they're different supervisory styles. And so if a super had worked with someone who was very process oriented and then moved to someone who's very task oriented, for example, if that wasn't discussed explicitly, that might be an example of where you might get that mismatch in terms of expectations.
Okay, so this seems to speak back to your point earlier about the contract or the informed consent, depending on which relationship you're talking about, to really make that clear at the outset.
Absolutely.
What's going to happen, although even if you're really clear about it, there can still be those kind of mismatches that I'm sure you'll talk later about how to address those.
Exactly. So the next big group I can think of are sort of normative conflicts, and those are just kind of, as you said, Rod, as in any relationship, just as you're working together, things will come up. And so one example of that might be, depending on the supervisee's level of professional development, they may desire more autonomy. For example, as they're trying to sort of practice their skills and trying to practice a little bit more independently, but they may not be ready for that in the supervisor's estimation. Also, new supervisors may tend to want to be more task-oriented because they're still trying to develop their own competence, and that might be an expectation, an expected developmental thing that we might see. But it does sometimes cause a rupture depending on sort of, again, how things have been discussed. Next category that I think about are interpersonal dynamics. And this looks a little bit different, hopefully, for the therapeutic relationship and the supervisory relationship. In therapy, what research has found is that the client attachment style, personality characteristics. Those are all things that can sometimes cause ruptures with, I'm sure we can all kind of think about clients who maybe because of personality features, may just have a more difficult time trusting or bonding in therapy. And it makes sense as those clients we might experience ruptures more easily with those clients. Ideally, in the supervisory relationship, we are not dealing with as many personality characteristics or attachment type issues, but occasionally those do occur and need to be addressed. Other interpersonal dynamics that come up in the supervisory relationship might surround shame, and so a lot of our supervisees might be more prone to feel shame as they're sort of trying a lot of new skills and doing things that require a lot of vulnerability. And so being able to give them feedback in a way that's not shame-inducing is really important. Otherwise, that can cause a rupture. I also think about things like parallel process, which I know we're going to discuss in another presentation, but just the dynamics that might occur as clients as supervisees might sort of recapitulate that relationship that they're having with their clients in supervision, and that can sometimes cause some confusion. That can also be a dynamic that causes a rupture. And of course, boundary violations. And that, I would also encourage people to kind of think about, depending on communication style, cultural characteristics, how those things might cause some interpersonal dynamic confusions that can lead to rupture.
All right, so boundary violations. I do a couple of examples come to mind for you as you're thinking about this.
The one that probably comes to mind most easily, if I'm thinking about an interpersonal dynamic, is if you had a supervisor maybe who had a more process-oriented or interpersonally focused, or maybe uses a lot of use of self, working with a supervisee who might have been trained in a more manualized treatment model, where they may be used to more skill-based interventions and haven't had as much supervision that focuses on their own process and reflecting on their own process, that might feel very intrusive. And so that might create a disruption in the supervisory bond as they both sort of negotiate how to manage that.
Okay. You'd mentioned that before I interrupted you on that, you were just starting to say something about culture, I think.
Yep, and that would be the fourth big groups of causes for ruptures. And so I think there's so much diversity, and diversity is so complicated, and we all have salient identities, and those identities intersect. And so I think whenever you're in a dyad, whether that's the client therapist dyad or the supervisee dyad, there's lots of room for unintentional cultural conflicts that might arise, where we might unintentionally offend someone or not devalue somebody's identity without recognizing it. And again, if we haven't created a way to create space for addressing those when they occur, and being extremely self-aware as either supervisors or therapists when they may have occurred, those can also lead to ruptures in the supervisory or the therapeutic relationship.
We talked earlier about power dynamics and power differential, and it seems to me that can get even more accentuated perhaps in across racial or cross-cultural supervisory dyad or therapy dyad, where there are power differences, and it just really amplifies, it seems to me, your point about having those candid conversations at the beginning of the relationship about permissions.
And I think, again, it's just always ideal if, because we hold the power in both the therapeutic relationship and the supervisory relationship, that we're trying to be as aware as possible of when a strain or rupture has occurred, so that if it is caused, especially by a cultural misunderstanding, that we initiate addressing that as quickly as possible, because the supervisory or the supervisee or the client may or may not feel empowered to do that.
What are some ways that a supervisor might recognize a rupture has occurred? What should they be watching for? And by the same token, What should they be teaching their supervisees to watch for with their clients?
So I think it's helpful to kind of think in terms of categories. So I think the signs of ruptures, there could be, they're plentiful, but the big two categories would be a confrontational rupture, or there's a more overt sign that there's been a rupture. And so the client may get angry or tell the person, the therapist, that they don't agree with the goals or they don't agree with treatment. And, you know, I guess the most clear sign of a confrontation rupture in the therapeutic relationship would be the client terminating, or often just choosing not to schedule a follow-up appointment, although it's clear that the work of therapy hasn't been completed.
Mm-hmm.
I think in the supervisory relationship, confrontational ruptures are kind of more difficult because of the power dynamic and because our supervisees can't leave. But I think for more empowered supervisees, and if you've created that space, then they may tell you that they are disappointed or angry about some sort of misunderstanding that has occurred, or they may challenge following through on a treatment recommendation that you have brought up.
So it seems to me that that may not feel good to hear, but at the same time, it's important, and it's back to if they do challenge you, it's because they've heard that permission to do so.
Exactly, and I think, as you said, Rod, confrontation ruptures are sort of difficult to sit in because you're being challenged, and also in some ways ideal because, as we'll discuss, the withdrawal ruptures are much more subtle, and therefore they're easier to miss.
Would you talk a little about those then?
Sure. So in the therapeutic relationship, it might look like, I think, clients who are maybe turning up a little bit later for sessions. Maybe they're, you know, I like my clients to start working early in the session so we get a lot of work done. So they may be just less proactive in terms of sharing what's going on in their life, or getting to the more difficult stuff in sessions, or they may become more acquiescent and just more agreeable with everything that the client says, for a client that may be used to ask more questions or push a little bit more. Similarly, in the supervisory relationship, you might find a supervisee who would ask a lot of questions, maybe ask about treatment recommendations, also engage in appropriate amounts of risk-taking as they're trying out different clinical behaviors, may become much more agreeable, may stop asking questions, may just follow through on what the supervisor is asking them to do. I think one of the things that happens a lot in training clinics is that they start being much less willing to show video, or to show, when they do show recordings of themselves, they show themselves doing good work instead of themselves, you know, the parts of the session where they may be more challenged. And all of those things, I think, can be signs that something has happened, that there's been a strain or a rupture in the relationship.
Right. And as you pointed out, this is more subtle, and this really does take a little bit more skill on our part to be attuned to maybe something has changed, and it's not nearly as direct as the confrontational ruptures. So
absolutely. And I think, again, that self-awareness is so important, because one of the best signs, I think, or what I try to reflect on, is if there is even very good dialogue and just very good energy in supervision. And I notice that that's sort of shifted, where even though, again, the supervisee is talking, they just don't seem as engaged. There's a shift in engagement, or just our bond. Then I know that some things happen, and then I can start sort of thinking back to try to identify where that might have first occurred.
Okay. So you've talked about categories. So what do we do about it? So what kind of protocols or like mental map should a supervisor have for thinking through about how to repair ruptures?
Good question, Rod. And I think it's sort of bringing it all together. So I think about, I think that's a great place if you're in the supervisory position, or what you want to teach your supervisees to do is to use consultation. And so your supervisee would be consulting with you, but you could certainly consult with colleagues, or if you have a supervision group, to try and think back. I think it's a great place that if you've used recording, which ideally we're all doing, to kind of go back into the recording to try and see when the things first change. So the first step would be identifying the rupture marker or identifying where the rupture may have occurred. I think once you found that out, then you want to try and again think of those 4 categories of causes to try and figure out, why did the rupture occur? So was there a shift in, a difference in expectations about what was expected in supervision or therapy? Was there something that happened interpersonally? Was there a cultural conflict? So what occurred that might have, so that you're beginning to formulate a theory of what might have happened. I think it's helpful to do that if you have some space between when the rupture occurs and when you want to address it. But ideally, actually, we're doing all of this automatically. And then what we want to do is talk to the supervisor or client about what we think has occurred, so that collaboratively you can actually kind of figure out what occurred. And one of the best ways to do that is to talk to them about what you see occurring between you in your relationship. I think the formal word for that is meta-communication, but it's sort of communicating about your communication. And so if I think about when I've done this, then it might be having a conversation about, you know, I've noticed that our dynamic seems to have changed. You seem a little less reserved, and I'm curious what that feels like to you. And you know, if there's anything we can discuss or explore about what's shifted in your relationship. So you're really inviting them to engage in this exploration about where you started, how things have changed, and what their experience of that has been. I think in that process, it's really important, as we said, sort of when we were talking about the confrontational rupture, to be aware that you may get feedback that you don't, that's hard. And so how do you sort of tolerate sitting through if a supervisee starts saying that you felt dismissive or you made a culturally inappropriate comment, that you're really coming from a space of humility. So you're being
really easy to get defensive when you're feeling okay.
Exactly. So you really want to lean into these conversations with a lot of humility, being really open to what anyone is sharing with you, and teaching your supervisees to do the same. You want to take responsibility for any part that you may have played, whether that was, even if it was unintentional. You want to validate any feelings or reactions that the supervisee or client brings up, regardless, again, of how you may therapeutically feel about it, so that you can kind of work on repairing the rupture. And then I would say the last stage would be to see if you can come to a space of realignment, and see if the expectations were off. How do you have a conversation about collaboratively coming to a place where you can come up with shared expectations for what supervision or what therapy would look like in your setting, in your model, that both of you feel like you're on the same page with. If it was a cultural conflict or an interpersonal dynamic issue, how do you have a conversation about that so that it feels like you're moving on from a space of better understanding, and again, better understanding that if another rupture were to occur, that it could be addressed as immediately as possible.
Well, thank you. So thank you, Lisa. This has really been very helpful. I think you presented so thank you, Lisa. This has been really helpful, and I really appreciate the framework you've given us, and I hope that it'll lead to some better understanding. Certainly I came up with some better understandings of what ruptures can look like in both therapy and supervision, and how we can work with those.
Thank you, Rod. It's been a pleasure.
Okay, thank you. All right, so we got that. I think we have it. So,
okay, well, I know sometimes I stumble and talk too quickly and whatever.
That makes it natural, I think.
Well, if you look at it and you want to do it again, it'll actually be easier anytime in the next few weeks than it was this week.
Well, I'm eager to get, so if I can, I'll try to get this done in the next few days.
Okay.
I'll run it by you, and then I'd like to run it by the group as an example. Again, you've been kind of our guinea
Guinea
pig.
pig.
But I really like the way this is coming together now. So
Good. I'm glad.
good.
And again, I'm really sorry about Monday. It just turned into a crazy day, and I
Oh,
opened the email, and then I opened some other
no.
emails.
We waited to the last minute. So, Carol's scrambling. Carol and I both have stuff going on, and then she's leaving for South Africa on Monday.
Wow.
And she's going to be gone like 10 days. And anyway, she had all this stuff in the air, and she didn't get back to you quickly enough. So this worked.
Okay.
Okay. Thanks,
Great.
Lisa.
Well, let me know if you need anything else.
Okay.
Have a good weekend, Rod.
You too.